Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we will be talking about the importance of blood donation. And joining me in studio today is Ms. Radha Ramdari. Welcome to the program.
Thank you, Alicia.
Radha is attached to the National Blood Transfusion Services. Can you tell us about the National Blood Transfusion Services and what you guys do there?
All right. So the National Blood Transfusion Service is responsible for collecting, storing, and distributing blood across Guyana.
Okay, and how is that process carried out day to day? What is it like there?
All right, so in Guyana, blood is collected from voluntary blood donors. The blood donors come into the National Blood Bank to donate blood for patients in need in the hospitals. Now, our job is to provide blood for patients all across Guyana, both private and public hospitals nationwide. So this is a huge responsibility.
A huge task indeed.
Yes.
So how is this done regionally? I know that you guys are based in Georgetown, but you have different blood drive happening across the regions. How are persons able to donate in all the regions of Guyana?
Correct. All right. So in addition to the NBTS in the GPHC compound, we also have collection sites in Region 2, the Study Public Hospital, Region 3, the West Demerara Regional Hospital, Region 6, New Amsterdam Regional Hospital, Region 10, the Linden Hospital Complex, and Region 9, the Lethem Regional Hospital. So for persons that are interested in donating outside of Georgetown, these are the sites that may be a bit more convenient for you.
Wonderful. I know that 1 unit of blood can save up to 3 lives.
Correct.
And that's amazing to know. Could you tell us of the importance of blood donation? Why is it important for our listening and viewing audience?
All right. So as of now, there's no substitute for blood donation. Although this is the modern time, we still need blood from our voluntary blood donors to come in to donate blood. There are a lot of patients that require blood transfusions for various reasons. For example, we have patients the accident victims,
yes,
patients that are trauma patients. We have the maternity patients, they require a larger amount of blood. And oftentimes, in cases of emergency, we do not have the time to have persons physically come in to donate when it's needed. So this is why we're calling on persons to come in prior to events happening.
Yes.
So that way it's guaranteed that there's always blood in the bank in the event that there's an emergency and not a lot of persons are available to come into the blood bank to donate, because we do know that it takes some amount of time to get to the blood bank.
Yes, blood is always needed. And so it's important that persons go out and donate and just don't wait for a family member to, fall ill and then you decide that, I'm going to go and donate now. So you guys always need blood. Could you tell us about who might need blood and when? You did mention accident victims and persons with trauma and all these things, but we will never know when the blood will be needed. So could you emphasize on the importance of persons coming out and donating?
All right, so the accident victims who require blood transfusions, oftentimes you would see a lot of road accidents on the roads in Guyana. So one of the things that we're trying to let persons know is oftentimes, the patients do not require just 1 unit of blood. They require multiple units of blood. So in Guyana, persons only allowed to donate 1 unit of blood. So by extension, this means that a larger amount of persons are required to donate so that we can supply the demand that is required at that time. Now, because of the sites that we have, our opening hours, we also have what we call blood drives. For persons that are interested in donating blood outside of the blood bank, because a lot of persons are still skeptical when it comes to coming to the hospitals in relation to COVID and so many other things, we're willing to come to your organization. So that's one of the things we can do.
Yes, so that therefore means that you guys are willing to partner with different organizations and so forth.
Correct. That is one of the things that we do.
Thank you so much, Radha. We're going to go into a break and be right back with more on blood donation.
Give blood, save lives. 1 unit can breathe life, make someone smile. Donate blood and heal a life today. Give blood, save lives. You just have to give and save lives. A message from the National Blood Transfusion Services. Be a good Samaritan, be a hero. Donate blood, save lives. For more information, contact us on 223-7182 or 226-9022.
In 10 minutes, you could save 3 lives with just 1 unit of blood. Here's how. Each unit you donate is divided into the 3 components: red blood cells, plasma, and platelets. Each of these components have different uses too, treating different diseases, car accidents and burn victims, trauma patients, open heart surgeries, and so much more. Car accident victims and organ transplants require at least 50 units of blood. Burn victims need at least 20 units. Open heart surgeries require at least 10 units of blood. It starts with you and 1 single unit. So let's join in making the world a better place. 1 pint at a time, 1 life at a time.
Welcome back to the Health Matters program. For those persons who've just joined the program today, we're talking about the importance of blood donation. With me, I have Miss Radha, and she is from the National Blood Transfusion Services. Radha, could we talk a little bit about blood transfusions, especially for persons who have sickle cell or cancer patients? How does it work for them, and how often do these persons need blood?
Right, so the situation varies from patient to patient, but for the patients that have sickle cell anemia, quite often, patients may need to be transfused weekly, sometimes twice a week, sometimes more frequently.
More frequently.
Now, these patients require what we call red blood cells. This is the red part of the blood. And because their blood count is usually very low, the red blood cells is needed to take that level back up so they can function.
Okay.
Whereas the cancer patients require both red blood cells and platelets. Now, platelets is a specific quantity, the platelets is a specific component inside of the blood.
Yeah, so we'll talk about platelets in a few, but could you tell us about the blood donation process? What should persons expect when they visit the blood bank or even show up at a blood drive to donate blood?
All right, so the blood donation process is simple, it is safe, it is sterile. Keep that in mind. Now, the utensils that we use are sterilized. The blood bags that we use are single use, so it's never in contact with another person, with another patient, or another blood donor, right? Because a lot of persons have skepticism when it comes to being safe. We are one of the facilities that are very safe. Now, the blood donation process entails about 4 steps. So the first step is the registration. Here we're going to collect your name, your contact information, and demographics. Why we take your name and your contact information is we keep a record of the date that you donate and your blood group.
Okay.
So in the event that there's an emergency and the relatives of a patient of a specific blood type do not have or they're unavailable to come into the blood bank to donate, we can call back persons and ask them to come in to donate. There are a few times where we have done this and persons show up to the blood bank to donate for strangers. That is one of the things that happens. That's amazing.
It is indeed.
Now, after the registration process, there is an interview and a mini health check. The mini health check entails we're going to check your weight to ensure that you're 110 pounds and above. We're going to check your blood pressure to make sure it's within the acceptable range. We're going to check your hemoglobin to make sure that it's within the acceptable range. There is a range as to what it should be before you're allowed to donate. That is 12.5 grams and above. Persons below this range on the day of the donation will not be allowed to donate.
Okay.
Right? Now, we're also going to check your blood type at this time. For persons that don't know what their blood group is, a lot of persons don't know what their blood group is. So it's a pretty simple process to know what your blood group is, just a finger prick. Now, after this process, we're going to do the interview. Here, we're going to take some personal information from you. We need to know what medications you're on and if it may affect the blood transfusion or the patient receiving the blood transfusion. We're also going to ask you some very personal questions. Keep in mind, these are confidential. They may be a bit personal, but it is in keeping with the standard to ensure that the blood is safe to the patients that are receiving the blood. Now, after the interview, you move ahead to the phlebotomy. Now, this is the actual blood donation process with the blood bags and the needles. Here, you sit back in a recliner chair. This is the shorter process. This takes about 5 minutes of your time. After the blood donation process, there's the post-donation care. Here, you're going to have to sit for a bit, relax for another 5 minutes, and have your Vitamalt.
Could you tell us, is there an age requirement specific to persons donating blood?
Yes, there is. So 17 to 65. If you're 16 years old and you're interested in donating blood, you need to have parental consent from a parent or a guardian. In the absence of that, we have the forms someone can fill out. A parent or a guardian can fill out at the NBTS or at a blood drive. Persons beyond age 65 are allowed to donate if you have medical clearance from your physician or our physician.
Okay, and how often can persons donate?
You can donate blood every 56 days. So when you round that off, it's safe to donate every 2 months.
Okay, what is the most rare blood type or the blood type that is always in demand, mostly in demand?
Oh, so those are two different things. So the rare
Yeah.
or blood types are AB positive and negative. Those aren't very common.
Yeah.
They're a small group of persons, and they're the universal recipients. If you're AB positive or negative, you can receive blood from almost any other blood type. But if you're O positive or negative, you're the universal donors. But you guys are very special because in the event of an emergency and we do not have the time to physically check a patient's blood group, they're usually transfused with O positive or O negative because they're the universal
Yeah.
donors. Their blood can be given to any blood
Right.
group. So you guys are gold.
So we spoke about platelets earlier. Could you tell us what it is again, and is the process similar to the usual blood donation process?
So the platelet is a component of the blood. When it is transfused to a patient, it has a specific benefit. Now, the process of donating platelets at the NBTS is a little bit different. Now, the process that we have is what we call the Terumo blood collection system. Now, the donation is called an apheresis platelet donation. What this does is the equipment takes a quantity of your blood, centrifuges it. It basically separates the red blood cells from the plasma or the platelets that we're collecting. It keeps the platelets in the bag and returns the red blood cells to the donor, sorry. So there's no residual loss. This is a continuous process, and the time it takes is about 1 hour to 1 hour and a half. Now, persons are encouraged to donate platelets because, like I said, platelets has a specific benefit when it's transfused to the
Yes.
patients. The patients that require platelets often in Guyana are the cancer patients that are currently undergoing chemotherapy.
Okay, and how is these stored? How is blood stored at the National Blood Transfusion Services?
Alright, so when a person donates a unit of blood, it is what we call a whole blood unit. It is then separated at the NBTS by a process what we call fractionation. Now it is separated, the platelets, the red blood cells, and the plasma are separated. When they're stored at different temperature. The red blood cells is stored in a refrigerator, the platelet goes into an incubator, and the plasma is frozen. So the component that it's frozen lasts for about a year.
A year. Wow.
That sounds like a very long time, but because of the demand that we're supplying, it is not a very long time. Now, the red blood cells, because it's stored in a refrigerator, the shelf life is about 42 days. And the platelets that are stored in an incubator, the shelf life is about 5 to 7 days.
Okay, how can someone become a volunteer at the National Blood Transfusion Services?
All right, so you can visit us at the NBTS or you can give us a call and let us know your interests. And if you have any experience, we provide the training if you guys are interested in working with us on our blood drives or at the NBTS.
So organizations as well can reach out to you.
Yes, same method.
All right. Thank you so much, Rado. We're going to go into a break and be right back.
I'm Dr. Pedro Lewis, Director of the National Blood Transfusion Service. And as per starting of this year, the National Blood Transfusion Service took the initiative to start what is known as the leukoreduction process, or a special preparation. Simply means we're taking out 99.9% of white cells from the whole blood that is being collected from our voluntary donors. Right? This is a unit of whole blood here that you could see, and it's being passed through a filter. This filter here is what filters the white blood cells. So when this process finishes and the entire unit of whole blood enters into this bag here with the anticoagulant, it extracts 99.9% of the white cells. What does this mean to the recipient? It means when you take out the white cell from a whole blood, it prevents alloimmunization, right? Which means it reduces the amount of HLA antigens that goes into a patient. And once you reduce the amount of HLA antigens going into a patient, it reduces the risk of non-hemolytic transfusion reaction. It reduces also infections like CMV virus, cytomegalovirus, or Epstein-Barr virus. Because of course we know most of the virus lives in the white cells. And as long as you remove the white cells, you remove the virus. So this method here is very simple, but it's very expensive. The filter is expensive because it comes with the entire blood bag, and as long as it reduces the risk of fever, we know a lot of patients after receiving a unit of blood, they may call the hospital or may return to the hospital and say they get cold sweat and so on, is because of the white blood cells that is in the blood bag. It could be done in two ways. We know it as, in this process that we do in here, we call it the pre-storage leukoreduction process, and you could do the post-storage leukoreduction process. Simple means we are doing this before we put the blood into the refrigerator, or we're doing this long before the blood enters into the patient's vein. Why? Because the white blood cells also produce something we call cytokinase, and as long as you do it just after the blood donation, it reduces the risk of cytokinase producing into the whole blood. If you do it just before transfusion, remember the blood is being stored and cytokinase still produced there. So when it goes to the patient could still receive what we call non-hemolytic transfusion reaction. So this is it, simple. It's mostly for patients that has been multiple transfused, like thalassemia patients, sickle cell patients, kidney failure patients. Most important, premature babies could receive this type of product.
Welcome back. Rada, could you tell us about some of the blood drives that you guys have coming up?
All right, so one of the blood drives we have planned for February 11th is the Marian Academy. Now, this is one of the blood drives we have annually around Valentine's Day. Now, our target varies from time to time, but on average, our collection is about 300 persons donating on the same day. We're expecting to start from about 8 a.m. to 6 p.m.
Okay, until then, for persons who want to donate blood, probably come down to the National Blood Transfusion Services. What are your opening hours, and could you provide a telephone number for persons who may want to call to probably become a volunteer or to partner with you guys?
All right, we're open at the NBTS from 8 a.m. to 6 p.m. Monday to Friday, and on Saturdays 9 a.m. to 3 p.m.
Telephone number?
223-7182. We also have an email address. It's the nbts.guyana@gmail.com.
Thank you, Rada. Do you have any final words for those persons who are watching and probably have not yet donated blood and would probably like to in future? Any advice for them?
All right, so as I mentioned, blood donation is safe, it is sterile, it is simple. It takes about 10 to 15 minutes of your time. Our collection sites again are the Study Public Hospital, the Region 3, West Denmark Regional Hospital, New Amsterdam Public Hospital, West Linden Hospital Complex, the Lethem Regional Hospital, and the NBTS. We're located inside the GPHC compound, and all of the collection sites are open Monday to Friday, some Saturdays. We're open every Saturday. We're also open to having blood drives with persons that are interested. Our contact information is listed. For persons that are interested, you can visit us, you can give us a call, you can send us an email. Just reach out to us. We're willing.
Thank you, Rada, so much for joining me in the program. And I want to encourage you guys to keep up the good work that you guys are doing there at the blood bank. So this is where I say goodbye for now. Do remember that 1 unit of blood can save up to 3 lives. Donate blood today. Goodbye for now.